Time is brain, communicating in stroke emergencies. Welcome back. In the world of neurology, we have a mantra. Time is brain. It's not just a catchphrase, it's a biological reality. For every minute a large vessel stroke goes untreated, the brain loses roughly 1.9 million neurons. But here's the thing. Clinical expertise only works if the communication is just as fast as the medicine. Today, we're switching gears to demonstrate the effective communication required in stroke emergencies, from nailing down the timeline to managing the emotional chaos of the ER. The golden variable last known well, LKW. The most important number in a stroke code isn't the blood pressure, it's the last known well time. This is the anchor for every clinical decision, determining if a patient is a candidate for TPA or a thrombectomy. When you ask, when did the symptoms start, you might get a vague answer. Instead, be precise. Ask, what was the exact time they were last seen acting normally or at their baseline? If they woke up with symptoms, their LKW is the time they went to sleep. Document it, highlight it, and verbalize it to every team member you encounter. Translating urgency without panic. To a family member, our stroke shuffle can look like chaos. You need to bridge the gap between clinical speed and family understanding using plain language. Instead of saying, "We are initiating the thrombolytic protocol," say, "We are moving fast because every minute we save helps protect his brain cells." This validates the speed of the environment while giving the family a clear reason to trust the process. High-velocity handoffs. Stroke care is a relay race. The handoff from EMS to the ED, or ED to the neuro ICU, is where critical info often gets dropped. We use the S-bar method, but with a stroke twist. Situation: stroke alert in Bay 4. Background: 82-year-old male, LKW, 10:15 a.m. on Eliquis. Assessment: NIHSS of 16, right-sided hemiplegia. Recommendation: heading to CT now, neurology is meeting us there. The Calm Center, empathy. It's easy to become a clinical robot during a code, but a scared family member who feels ignored can actually slow you down with questions later. Spend 30 seconds grounded in empathy. Look them in the eye and say, "I know this is terrifying. We are doing exactly what we trained for, and I will update you the moment we have the imaging results." That 30-second investment builds the trust you'll need if difficult decisions arise later. The scenario, the 60-second impact. Let's look at this in practice. EMS rolls in. The spouse is crying. You. I'm the nurse doctor taking care of him. I need to know, what was the exact time he was his last normal self? Spouse. We were eating breakfast. Maybe 9:15? You. So he was speaking normally at 9:15. Spouse nods. Thank you. Team, LKW is 9:15. We have a clear window. Next, you pivot to the spouse. We're taking him to CT right now to see if we can clear the blockage. Time is brain, so we're moving fast, but we've got him. The result: you've secured the LKW, led the team, and stabilized the family, all before the stretcher even hits the brakes. In a stroke emergency, your words are just as much a tool as a CT scanner. If you can master LKWT communication, simplify your language, and lead with empathy, you aren't just communicating, you're saving brain tissue. Remember, ask for the time, explain the why, and keep the team aligned. Because when the clock is ticking, clarity is life.